Welcome to the Brookhaven Circle, a podcast to celebrate and explore the business community of Brookhaven Circle in Memphis, Tennessee. While Brookhaven Circle is known for its many restaurants, you'll find a lot more than good eating on the Circle, where many service and retail entrepreneurs have set up shop. Don't forget to subscribe to the Brookhaven Circle on whatever platform you listen or watch your podcast on. Just search the Brookhaven Circle and hit that subscribe button. The Brookhaven Circle is sponsored by V2 Media. I'm Mark Thompson. Now let's meet the Brookhaven Circle business community. Welcome to the Brookhaven Circle, a podcast about the businesses and the people and the entrepreneurs on Brookhaven Circle in Memphis, Tennessee. We're here to meet, engage, and celebrate the entrepreneurs who make up the Brookhaven Circle community. And today we're here with Dr. Reed Hickenbotham, who runs Dental Partners Brookhaven. So, Dr. Hickenbotham, thank you for coming on and appreciate your time. And tell me a little bit about your journey to Dental Partners.
Well, thanks for having me, Mark. And, I'm proud to say I'm from Memphis originally and went to MUS. And so my journey to becoming a dentist was, I don't think there's ever a straight line to becoming a dentist. But mine, I went to Ole Miss, and after that, I worked at a pediatric dental office for a couple of years while I was getting my master's in biomedical sciences at the University of Mississippi Medical Center in Jackson. And then after that, I attended A.T. Still University in Missouri, and where I earned my DMD degree. So
where is that in Missouri?
The first few years is in Kirksville, Missouri. It's about an hour north of Columbia. And the last 2 years, the clinical years, is in St. Louis. So
Nice.
Yeah.
Go Cardinals.
Yeah. Love Cardinals.
Yeah. It's a good time. St. Louis is a great
It's a
place
great
to
town.
live.
I kind of forget that it's only 4 hours north, and used to go to Cardinals games with my dad in the summer when I was growing up, and it's a fun town. So yeah.
It's a lot of fun. So tell me about, again, your journey and how you got to Dental Partners.
Dental Partners, it's been a dental office on Brookhaven Circle for a number of years. But when I was looking to come back to Memphis, an opportunity kind of presented itself to me to, practice at Dental Partners, and I was fortunate enough to accept and,
So tell me about Dental Partners. You tell me, if I don't know anything about the business of dentistry or anything, maybe I've never been to a dentist. What do dentists do, and what does Dental Partners do?
Dental Partners is, you see a lot more dentist office run like Dental Partners is, where as a dentist, you're solely trained to be a dentist pretty much. And you see a lot of offices that partner with dentists that run the business side of the dentist office, and allows the dentist to focus on dentistry and their craft. And I've been fortunate enough to partner with a really great company that has handled the front office and staffing and things like that, and allow me to be the dentist, but also give me autonomy at the same time. So in a sense, that's what Dental Partners is. But in terms of a dentist, my job is to, dentists do a number of things, as most people know. It's preventative dentistry, restorative dentistry, and emergency dentistry. But I kind of consider my biggest job is education, educating my patients into, their treatment, their diagnosis, how did they get to this point? What can we do going from here? And in doing so, I hope that I give them the information to where they can make a decision for themselves in terms of what they want to do with their teeth, what treatment best suits their needs. And in the same sense, hopefully give the patients some of that power control back, because I know a lot of people are afraid of coming to the dentist. And by giving them that power, that they feel comfortable, so.
It's the sound of the drill.
But yeah, so I always tell my patients, that they're the bus driver. I just have the GPS coordinates. I'm going to tell you which routes are safe to go. And, they get to pick, and hopefully that they feel comfortable doing so.
Yeah. And I know that your dental health has just a great impact on your overall health. Talk to me a little bit about that.
Well, you can see a lot of things that your patients, your people's health can originate, and you can manifest, starting in your mouth, heart disease, stuff like that. So it's a good indication, or gives you an insight of people's overall general health. And so by starting treatment with the mouth, you can, it's kind of like a fall downward kind of thing. So yeah. Mm-hmm.
It's not just your mouth. It's really treating, can treat many other issues that or prevent many other issues. Yeah.
When I was trained, that everything is connected in some way, and that there's not just fixing one thing, doesn't fix the whole thing. Everything originates from something. So being able to treat the whole person rather than just, like you said, the symptoms. So.
And I read in your bio, you said you were influenced by your family history of medical and being in the medical field. Tell me about that.
I always knew I wanted to be in the medical field. I always had a passion to serve people, and that definitely comes from a strong, family of medical professionals. My dad is a dentist. My uncle's a dentist, along with a number of other medical professionals, and it kind of pushed me in that direction. They didn't, but it gave me that comfort of seeing what that field was about, and piqued my interest and kind of pushed me in that direction.
Yeah.
So yeah,
well, just being in that environment, I guess, growing up in it.
Absolutely, it definitely gave me a comfort to be around my dad's office growing up, and I guess that's one reason I'm not scared of the dentist, is I just kind of grew up around it. But I can totally understand how some people may. My mom is not the biggest fan of a dentist, yet she married one, and her brother is one, and now has a son who's one. And but all jokes aside, she has great oral health. She still goes when she needs to go. So
I always think of, if you've seen the movie On Golden Pond.
I have not.
Well, it's an older movie. Henry Fonda and his daughter's going out with a dentist, and for his first line is, "You want to see my teeth?" It's like, no, thank you, no. So we talked about your family, and so you've been on Brookhaven Circle for quite some time, but how do you find this location for your practice?
Like I said, when I was coming back to Memphis, I was fortunate enough, I kind of feel like Brookhaven Circle chose me, and in the sense that an opportunity presented itself, and I accepted to practice on Brookhaven Circle. But growing up in Memphis, there are a number of places that are still here when I was a kid, and but there's so many new places now, and watching Brookhaven Circle grow has been a lot of fun, and I've been really fortunate and blessed that I'm on Brookhaven Circle now, and get to kind of continue to watch that grow, and hopefully be a part of that for many years to come.
Well, you definitely don't have to get in your car and drive to go to lunch, or meet somebody for happy hour or dinner, or even breakfast. Hoagie's has a great breakfast.
They've got everything on Brookhaven Circle, it seems like, these days.
Yeah, including a nice brew pub.
That's true.
We like it. So tell me about your customer base. Where do your customers come from? And
we see a wide range of patients, patients who have really good oral hygiene. See them twice a year, just kind of routine checkup, to patients who may not have had a routine or a dental home, and have more diverse needs, to people who may need full mouth reconstruction. But as they, sorry, I kind of messed up there.
Well, just to change directions a little, you mentioned a lot of people are scared of the dentist. What do you do to help break that down when they come to see you, and you can feel that trepidation, that hesitation?
Yeah, I think the best thing to do is to educate them, like I was mentioning, show them. I think the biggest fear is the fear of the unknown, not knowing what's going to happen. They can't see what's going on. Like you said, the noises can be disconcerting.
It's the worst.
It's not fun for the dentist either. It doesn't do well for the hearing. I'll say that. But just to be able to give them the ability to feel that they're in control, to know that this is a team effort. There's no treatment that I would ever force on a patient, but that they, I'm just a part of your team to help point you in the direction that is treatment that will best serve you in a safe way, and that we can make a decision together. There's no one way to treat something. It's kind of a puzzle piece, and be able to figure that out together and what best fits their needs and accomplishes what I need to do, and be able to let them have the autonomy that they desire and need.
Yeah. Mm-hmm. And I know that the pain mitigation techniques and treatments have come a long way, because I think a lot of people are very reticent about it's going to hurt, but that's not really the case much anymore, is it?
No, I mean they've come up. I mean some things in dentistry have changed, some things have not, but definitely having a good chairside manner, being able to be in tune with the patient and understanding their anxiety, and kind of being able to pick up on that, and there are other treatments that can be done if need be, if they aren't comfortable, and but it's all about managing their comfort and making sure, because the last thing we want is for them not to come to the dentist. We want them to be able to stay on top of their treatment so that they can maintain a good oral health, and so.
Well, you can't be in good health overall if you're not taking care of your teeth.
That's very true. Yeah.
Only brush the ones you want to keep.
Exactly. Yeah.
My wife likes to say that a lot.
Oh.
Okay, honey, I'm gonna brush them all. What are some of the biggest challenges that you've faced in your business journey?
I think some of the hardest things is, when Dental Partners is still running, the office, but being able to be a leader, but also having to focus on addressing your patient's concerns and also doing what you need to do. So being a person of many hats, but also being able to combat the fear of dentistry, gaining that trust of your patients, and knowing that you have their best interests at heart, and that being able to treat the patients, as they need, and accomplish treatment goals, even though some of the things may be difficult and unpleasant to think about. Procrastinating or putting it off can end up causing the situation to be much more invasive and difficult. So that's why I tell a lot of patients it's best not to wait. So
don't wait. Good advice. If you feel a little pain, have it looked at.
Yes.
It's not likely to go away, and to your point, it's only going to get worse.
And patients are really good. That's why I always try to listen to my patients, because nobody knows their body like they do. So kind of listen to the hints and the keys and the clues, and so.
So back to the way your practice runs, that seems like a pretty good operation. If you're allowing you to focus more on your patient needs than the business side. I know, I'm certainly sure there's things you have to do on that side, but having someone who helps run that operation, again, lets you just focus on your patient and the patient needs more.
Absolutely. We have a really great team and great staff at our office that truly care about our patients as a person, but also, their dental health. And I'm fortunate to have a really good office staff that allow me to do what I need to do and take care of the things. I'm a big believer in, if somebody does something better than you, let them do it. And that's very true for that. If I stick to what I can do and they stick what they can do, it's a great combination. And so yeah.
Yeah. That's very true. But I was going to ask you what advice you would give to someone just that wants to start a business, and I think just that, find people who are good at doing things that you aren't good at,
Absolutely.
and let them do it.
Yeah, it's very fortunate that I have people that can do that, because I know I couldn't do it by myself. Probably would have a few more gray hairs and.
Yeah, the paperwork and forms are not my friend, and that's why Hazel. Thank you, Hazel.
It's not a job for a faint of heart, for sure.
No, particularly the the tax forms and this and that. Yeah, paperwork is not our friend. No,
I'll stick to the teeth.
Yeah, right. Let me stick to that. That's what you trained in.
Exactly. Yeah.
I never had a course in paperwork the whole time I was in college.
Well, all the dentists I know have always said, we really need a course in business management and all that stuff, because you're a small business owner, and still haven't gotten them. So I'll let them keep working on that.
Let them do the thing. What's the favorite part of your business? What is it that really gets you fired up and you think, man, that's been a good day?
Being able, with setting all aside people's fears, because that is a hard part of the job of knowing people who I'm first meeting and they don't want to be there. You never want to do that, but I enjoy being able to break through that wall, earn their trust, and being able to work with them to make them feel more comfortable with their smile, but also knowing that they're healthier at the end of the day. And knowing that they are now comfortable coming to the dentist, and that they're in a different place than when I first met them. Put
them at ease. This isn't going to hurt. We're here to help you.
Yeah, absolutely. And work with us and not against us. And we're very in tune with that. And just being able to get to know the patients too throughout that journey is a lot of fun. You rather than seeing somebody once a year, once every 2 years in other professions or whatever, I get to see some people regularly, or a couple times a year, and being able to meet them and get to know them as people. You're not just treating a person, you're treating a patient, a friend, somebody that on a different level, and so it's rewarding in that sense, for sure.
So if there was something that you'd want somebody to know about Dental Partners that they might not know, what would you want somebody to know about your practice?
Just that we truly have a great staff and a great office who care deeply about, our patients' oral health, but also them as people, and that everybody in that office is dedicated to work diligently to ensure that we work to meet their needs and goals, and that we, do that as a team, and no concern is too small, and we certainly want to change the way you think about coming to the dentist, for sure. Yeah.
And Brookhaven Circle is a great location. You're right in the middle of the city, and it's easy to get to.
We have patients from all over that come, from Mississippi out east, further out west, downtown. So we're really in a fortunate and lucky location to be at Brookhaven Circle. The biggest challenge we have is taking a left at 5:30. I think I just saw a wreck there a week ago. It's challenging to say the least.
I didn't mean to hit that guy. I didn't mean to.
Well, my wife and I used to live downtown, and the hardest thing about moving out here was having to take that left instead of that right. So
So what's up next for Dental Partners?
Right now we're like many offices in Brookhaven Circle. They're old homes. Just kind of, you were giving me the tour here, and we've gone through some renovations lately, and there's some more up ahead. I've kind of got some ideas of what I want to do, but Memphis is such a prideful town. I'm very proud to be from here. And every Memphian that you meet, there's that bond like that. So to be able to incorporate that into the office, we just recently hung up some artwork and different vinyl albums and stuff like that tied into the community, but to kind of reflect our pride and being in Memphis. So some more, changes and kind of make the office more functional and stuff like that. But, just continuing to accept patients and, treat them best we can and do whatever we can to help them have, a healthier mouth and, more confident smile.
Treating Memphis one tooth at a time.
Yeah, there you go. Yeah. I should have thought of that myself.
It might work. I don't know.
I think it will.
So if somebody's looking for you, if they watch this podcast, how do they find you?
They can call us at 901-682-3100. Our website is also www.memphisfamilydental.com. Either one of those, be happy to help you out and get you in the office to come and see us, and we'd be happy to see you.
Great.
Yeah.
Well, Doctor, thank you for being on.
Thanks
with us,
for having me, Mark.
So if you've enjoyed this podcast, subscribe. You can find this podcast on YouTube, on Spotify, on almost any platform that you listen or watch your podcasts on. Please leave some comments. We're happy to hear those, unless they involve how bad the host is. He already knows that. We're looking for a replacement. If any one of you want, please. Anyway, thank you, and we'll be back with a new segment next week.
Thanks for joining us on the Brookhaven Circle. Please subscribe to our podcast and send us any questions or comments you have. The Brookhaven Circle is produced by V2 Media, a part of the business community on Brookhaven Circle.